So I think we both could share countless success stories. Um, I'm actually going to share with you guys a story that was technically deemed to be a JADA failure, but I guess I always see it with a little different lens because at the end of the day, it was a tool that we used that was still very helpful at taking care of that patient. So this is an example. This is actually a patient of one of my colleagues. I was on the floor. I will do some laborist shifts sometimes and cover the residents. So I happened to be there on the floor as a laborist. And it was one of my colleagues' patients, but as a 29-year-old multip, came in at 39 weeks for an elective induction of labor. She had no significant risk factors for hemorrhage that were identified. She had an uneventful labor course, a successful vaginal delivery. Immediately after delivery of the placenta and the baby, she had aggressive bleeding. They performed manual exploration. She received multiple uterotonics, and then they attempted to insert JADA at that time. They had bleeding. I think the QBL that was documented. We also do QBL at our institution, and the QBL I think was 400, but I would tell you clinically I think it was more than that when I walked in the room, but that was documented. So they placed JADA with a documented QBL of 400. They had bleeding around the balloon into the vagina, and so they weren't achieving the results that they were hoping for. So they removed the JADA at that point, noticed that they had significant clot burden, and that's when they called me in at that time to assist. So again, we evacuated the clots, we replaced the JADA, and confirmed placement with the ultrasound. We confirmed that the cavity was clean, there was no retained placental tissue, clot burden. With the JADA in place and suction activated, we then had no bleeding around the device. We watched the myometrium contract down. We had blood flowing through the tubing, so we knew it was working effectively. And so we began just to observe and to see what would happen. Remember how I told you, most of the cases, you barely get enough blood flowing through the tubing to get to the canister. And for this patient, the blood was just coming through the canister and just coming through the tubing into the canister. And we stood there and we just watched the canister continue to fill. And so after about 7 minutes, we had an additional 800 milliliters of blood in the canister and it wasn't slowing down. So at that point, we knew we needed to do something more. We knew we needed to continue down our algorithm and escalate care. The nice thing was that we knew exactly how much blood she was losing because we were capturing all of it. So we were visualizing her blood loss. There was no bleeding going anywhere else in her vagina, onto the peri-pad. Everything was being collected in the canister. So for this patient, we packaged her up, took her down to VIR. She got embolized with the JADA in place, and then came back from VIR. We were able to remove the JADA after about an hour observation period. So her total QBL documented for this case was 1,200 milliliters. So while JADA wasn't able to successfully treat her abnormal bleeding before it turned into a hemorrhage and we did need to escalate care, I still think it was a helpful tool to help us figure out what our next steps were and prevent that delay in care. So it's something, and I'm not sure we emphasize that enough today about how quick this device is to use, to place. Insertion time is usually less than a minute. It causes the uterus to contract down, usually in less than 3 minutes. And so if you can get control of bleeding in less than 3 or 4 minutes and put that in context to our standard uterotonics that we use, and those can take anywhere from 5, 30, 90 minutes, depending on which modality that you use. But to be able to get control of their bleeding or know if you're in control of their bleeding within 3 or 4 minutes is pretty impressive. So it allows you to escalate care much quicker. So for her, she was able to avoid blood transfusion. She was able to successfully breastfeed her baby, and she was discharged home on postpartum day number 2 as she otherwise would. So at the end of the day, I feel like it was very helpful in her management. Although it wasn't necessarily a JADA success, it still helped us in her treatment and making sure we didn't delay her care or her treatment.